What I'd like to say in Canada, there's probably been 4 major changes at the national level, and they're not very much. The first change that affects everybody is that our criminal code was changed to make elder abuse an aggravated situation. If someone is indicted, they're going to get the book thrown at them, which is, in some ways a good change. The second big change that we have in Canada now is that we have the Canadian Longitudinal Study on Aging, which actually collects blood and urine right through to retirement behavior. And it is a 20-year program. It'll go for the next 20 years. And what the federal government decided to do this year, which was very, very wonderful for all of us, is that they have taken the national prevalence study that we're in the process of doing right now, and they have included it in the Canadian Longitudinal Study on Aging, which is pretty amazing for the next 20 years. So we'll have a really much better read on what is happening in Canada. I don't know how many things that I say for. There may be one more thing that we have in Canada that most people don't have, is that we actually have a chair in elder abuse in Quebec. And that chair provides leadership in organizing programs and offering care and in research. So that therein covers the U.S. Canada. I was going to say we don't even get close to the U.S. We don't have any of the things they have. So what I want to say, I'm sorry, I'm on drugs. You may very well be if you're older. What we have done in Canada, we haven't had a national prevalence study since 1989. So that's a little old for all of us in terms of really doing anything that matters in Canada. And this prevalence study is extremely important to our federal government and to our provincial governments in terms of having to know what is really the size of the problem in Canada. And secondly, with more accurate data, we can start to screen properly, classify properly, and offer appropriate intervention, recognizing that Carl is absolutely right. There are very, very few studies in the world on interventions that actually work. I'm not going to go through all this. What I want to talk about is the national prevalence study that we are doing in Canada right now. The point of the study, of course, is just to find out how bad is the problem, what are the risk factors for the problem, and what we did add now that we have had 5 provinces join into the study is that we will now have a list of the major services from the 5 participating organizations from the different provinces. The thing about the study is that it's based on a 2-year pilot study wherein we decided to use age 55 as the starting point, simply because we wanted to be able to compare our study, for example, to your study in Ireland, to the study in Israel, to the study in Great Britain, and so on. We designed our study so that we can make international comparisons. It is a telephone survey. Excuse me, it's a telephone survey of about 1 hour, and it is being done on a random stratified sample of Canada with, as I say, 5 provinces added in. The usual culprits for abuse are being studied with a couple of new twists that we were really interested in. And one of the interests we had is trying to find out the difference between all the measures that all of us use in all of our surveys, and most people use the conflict tactics scale, etc. We wanted to look at what is the difference between what people reported as happening to them and then what they said or how they felt in terms of what happened to them. And as you'll see in a minute, we found a huge difference between the two. And I will say that started out of the pilot study, which Westat was very much involved in. These are the provinces that have paid hard money to oversample. Basically, our total sample will ultimately be 8,000 people. And what I'm just talking about here is about half of that. I cry and whine because we had a strike in Toronto, so we're not done. But it is a random stratified sample. These numbers will become more precise, hopefully, when we get the whole sample. I've highlighted anything that may be of interest. And I will say that our findings are very different than the studies in the United States. But closest to the one done in New York, which you were involved in, called Under the Radar, which is a really good study to take a look at. Anyway, you can see that we have a balance of men and women as it is in our particular society. In Canada, the age tends to be younger people. And this kind of is interesting to us because many people in the practical field, actually working with older people, often say, oh, no, it's the very frail elderly. But we're not finding that in the community in Canada. We are also finding that the people who are being abused basically have a fairly higher education, with up to 29% having gone to university. Most are married, of course, 62%. And then if you're interested, you can read the rest. We have other breakdowns. This is just hot off the press yesterday because it's not done. In terms of social isolation, 16.5% of people say that they are socially isolated. Do they feel socially isolated? Do they feel socially isolated? 16% say, or 17% say they are. 25% say they really feel socially isolated. So again, we're trying to get at the whole issue of how people feel and basically what they report using the usual social isolation scales. In terms of activities of daily living, I think this just confirms that it was the younger folks in the 60s are the people, at least, that are being abused thus far in our sample, that there is very little wrong with them. They are physically quite fine. About 10% of them, and we did find in our pilot that depression is a risk factor for abuse. And 10% of our study thus far are depressed. When we look at and you can yell, Carl, when you look at the psychological abuse reported, 33% reported psychological abuse. And I honestly think there's something wrong with that measure, because it's true. My husband can yell at me all the time, right? I don't care, it's water off a duck's back. So you sort of, like the scale starts out, somebody yelled at you. We'll go through, I'll just quickly go through it in a minute. Okay. In terms of physical abuse reported, 2.3%. That number kind of matches what was found in the UK study. In terms of sexual abuse, 1.5% reported that. And financial abuse really surprised us. Unlike the United States, 2.4% of people basically said that they were financially abused. It could be the measure. There's never been a real standardized measure of financial abuse, so we're not sure. But I do know in Canada financial abuse is the worst. Well, it may not be. Here is the psychological abuse. Like I say, my husband criticizes me, yes, and he yells at me. He doesn't insult me, though. And so if you go down the list, this is the list that most people use. We may be over-reporting psychological abuse, to say the least. In terms of the number of times, only 1 or 2 times did the person experience that in the last year. And then when we look at did they feel abuse, only 6.1% said they felt abused. Now, that's a huge difference from 33% actually marking off on the scale that they were abused. So we're really wondering about that. The other thing that I neglected to say is at the bottom. And we think perhaps we have found a new risk factor. The theoretical framework informing this whole study was a life course perspective. And so we were really interested in abuse across the life course. So what we found, and this is a consistent finding that you'll see with all the types of abuse, that if you were 17 years of age or under, 22.4% of those people were abused at that time when they were that young, 17 and under. If we go to physical abuse, you can see the various kinds. It only comes out to about 2%. Restrained you, held you down, throwing something at you, those are fairly significant factors. And in this case, the overall 2% for this type of abuse actually occurred back in 1989. It hasn't changed much. I mean, the numbers have changed, but excuse me, the proportion remains the same. The interesting thing here, again, is did people feel physically abused? Only 0.3 did compared to 2%. The stage of life, we have the same thing again. If you were abused as a young child, guess what? You were abused as an older person. Whoops, I can't read anymore. Sexual abuse overall was 1.5%, and the major type basically was people talking to you in a suggestive manner. This happened maybe only 1 or 2 times. Again, this is in the community. Did the people feel sexually assaulted in the last 12 months? 0.2%. Again, a number lower than what was going on. If you look down at a life course, again, they were abused very young as a child. And financial abuse is different, and I think it's because it's not a standardized measure. I can't see that far. Thank you. Sorry. Oh, I'm done. Let me know, I'm just one. Anyway, financial abuse has a different format than all the other types of abuse. And for the life course, it's in middle age. I mean, obviously, you're not going to financially abuse a child, really. In middle age is where that becomes a predictor, because we've run a few regressions, but I won't bore you with them, that predicts. And the other interesting thing is felt financially abused. Again, people were abused, they didn't feel that way. So this table summarizes it all. You can take a look at it. The whole point is, except for financial abuse, everybody marked off their scales as abused, but didn't feel that way. So, one of the things we have that other people don't have is this discordance between the two measures. What we intend to do is to use, what we did is we collected qualitative data for every one of the abuse, so people will say, we'll say to them, you marked off you were blah, blah, blah on the scale, and then we get their qualitative response. Can you tell us about what happened? And again, thanks to Westat, we have a way of coding that information, and we hope we will have a much better measure of elder abuse, which includes both our scales and how people report it, like how they feel about it. And the second thing that we've discovered that we can't find anywhere else is the whole business that if you were abused as a child, and I'm not talking about middle age, I'm not talking about, we even asked in the last year, 1 year from the time you turned 55, were you abused? Nope. It's all when they were young children, and that has become we think, a very important predictor of abuse. So enough already. My 5 minutes is up. I don't need a minute. When I was born,